are you Ricky Bobby?
Yep.
Well, my name is Danielle, and I'm going to be your nurse anesthetist today for your procedure. I'm just going to go over some questions, some history. A lot of this I already looked up. I already looked up your EKG and your labs you had done before you came here today. I'm just going to verify that everything's correct and talk about your anesthesia plan for your procedure today. Can I get your full name and your date of birth while I look at your scan here?
Ricky Bobby, 10/12/80.
Perfect. I have that you're 40 years old and that you are 6 feet tall and about 200 pounds. Is that correct?
Yep.
And can you tell me what we're doing for you today?
Taking my gallbladder out because I have gallstones and attacks that cause me pain and make me feel sick.
Perfect. And we're doing that with Dr. Firestarter. So I'm going to go over your allergies. I see you have an allergy to penicillin and it gives you hives. And you're also allergic to sulfa and that makes your tongue swell. Is that correct?
Yep.
Perfect. You don't have any latex allergies?
Nope.
All right. And have you had anything to eat or drink since midnight last night?
Nope.
All right. I have that you take at home. I'll go over your medications. Just let me know if these are right or wrong. You have Prevacid 30 milligrams once a day?
Yep.
Did you take that this morning?
Nope.
Okay, you take lisinopril 20 milligrams. And when's the last time you took that?
Last night.
Okay, perfect. And you take atenolol 50 milligrams twice a day. When did you take that last?
This morning.
Awesome. I see that you take liquid Advil. When's the last time you had that?
7 days ago.
And what do you take that for?
I don't know.
Is it this back pain I see on here?
Yeah.
Okay. I see that you also take ginger tablets. When's the last time you had that?
7 days ago.
And you take Tums as well?
Yep.
And that's for mostly this nausea and vomiting you've been having with the gallbladder flaring up?
Yeah.
Okay, perfect. Let's see. So I see here that you are a smoker. Can you tell me how much and how long?
1 pack a day since I was 14.
Okay. And when's the last time you had a cigarette?
Probably today, this morning.
Okay. How often, if you do you drink alcohol?
Yeah. I drink a lot on the weekend, about a case.
And any during the week?
Yeah, somewhat.
Okay. And then I ask these questions so that I can give you better care of anesthesia, give you the right amount of drugs for your surgery so you're comfortable and don't feel any pain. Some of them might seem a little personal, but I really just want to take the best care of you. So you drink some alcohol, you smoke. Do you take any other drugs at home?
Some funny cigarettes.
Funny cigarettes. Okay, and what are those for?
To make me feel good.
All right. They make you relax? Is that kind of the funny you're feeling?
Yeah.
Okay. And how often do you take those?
Every so often.
All right. And when's the last time you had one?
Last night.
Okay. So I have your medical history here. I see you have back pain, and that's why you said you take the Advil. Is that bothering you a lot today, or that's pretty under control?
That's pretty under control.
Okay. And with the smoking, do you have any kind of cough, in the morning, at night? Do you bring anything up?
Yeah, usually some crud or like phlegm.
Okay. Is that all day, or is that just at one part of the day usually?
It's like when I wake up.
Just in the mornings. Okay. I see for heart history, you have some high blood pressure. You're on a couple medications with that. Do you take those medications regularly at home, like you're prescribed?
Yeah.
Okay.
I take those.
Do you ever take your blood pressure at home or go to the doctor and get it checked? Do you know where it kind of sits around?
Yeah. I just take those, so I should be fine.
Okay. Well, it's still good, even though you're on these medications, to still take your blood pressure because while they treat it, they don't actually cure it. So it's good for you to follow up out of here with your doctor if you haven't seen them within the last year. It would be something I would recommend. Have you ever had any other heart issues? Like, do you have pain? Do you have like fluttering, weird dizziness, anything like that?
Nope.
You've never had a heart attack or any stents put in?
Nope.
All right. I see you have a history of reflux and GERD. That's why you're on that Prevacid and taking those Tums, I assume. That's been pretty bad with the gallbladder lately.
Yeah.
How long has it been going on?
A couple weeks.
Okay. And when's the last time you vomited with that?
A couple days ago.
Alright, have you been able to eat anything in the last week, drink anything, any fluids, anything like that?
Just like soup and stuff, but not really.
Mostly just fluids. Do you have any problems with your kidneys, going to the bathroom, anything like that?
Nope.
No, okay. For, let's see, a history of surgical procedures. So I do see you've had general anesthesia before. You've had your appendix out 5 years ago, is that right?
Yep.
And you've had a left knee arthroscopy 2 years ago?
3.
3 years ago? Okay.
Oh, 2 years ago.
2 years ago. Okay, perfect. That's what I had. And an upper GI scope 3 years ago?
Yep.
Okay, do you know if you had any, did you have any major bleeding with that, or no, nothing crazy? Okay. With all these procedures done, have you ever had any issues with anesthesia, any trouble breathing, extended stays, anything like that?
They usually tell me I'm hard to keep down.
Hard to keep down, wild man, okay. Does anyone in your family have history with anesthesia or issues with it?
Nope.
You've never heard anyone saying they had like a really high temperature during surgery?
Not that I know of.
No, awesome. So the plan we have for you is general anesthesia. I kind of talked about that. We're gonna give you some meds to relax you here, take you back to the OR. We'll give you more medication to kind of knock you out, and we're gonna put a breathing tube in to help you during the surgery to keep you stable and comfortable. Do you have any questions about that process?
Nope.
Nope. Okay. I'm gonna do a quick exam here. I know you've been nauseous, so I'm probably gonna give you some medications for that as well to help before we go back.
Okay.
Are you having any major pain right now? Your gallbladder's doing okay for the most part?
Yep.
Okay, can I have you grab both my hands and squeeze nice and tight? Perfect. Can I have you push your knee up against my hand? And this knee? Alright, nice and equal. I'm gonna feel your pulses here. And those are good. These ones as well. Perfect. Are you having any shortness of breath, chest pain, anything like that?
Nope.
Nope. Okay, I'm going to take a quick listen here. You can take a couple deep breaths for me. Okay, and a couple more on the back here. And then one more. Perfect. Everything's sounding good. I'm going to touch your stomach here just to make sure nothing's too hard. I see you're a little bloated. This isn't hurting too much?
Nope.
Okay, great. I'm going to check your airway, and to do that, I'm just going to have you do a couple exercises with me. Can you touch your chin to your chest for me? Perfect. Are you having any pain, numbing, tingling?
No.
Nothing? All right, lift your head back up towards the ceiling and try to push against my hand here with your chin. Perfect. And no issues there?
Nope.
All right, can I have you open your mouth and stick out your tongue for me, wide as you can? Perfect. You can put that tongue right back in, but open up your mouth again. I'm going to go on the side here. Perfect. And then you can close your mouth. I'm just going to place my hand under your chin. All right. And if you could, try to take your bottom teeth and try to bite up over your teeth like this. Other way around. Bottom teeth up over. Perfect. Looks good. Do you have any caps, any crowns in your mouth, anything that's loose or removable, dentures, anything like that?
Nope.
Everything's nice and stable in there?
Yep.
Perfect. I'm going to check your IV here. It's in your left hand, I see. Nice 20 gauge. Looks like it's flowing well. I'm going to open your fluids up just a little bit just to get you hydrated before surgery here. So you went through and you discussed the procedure with Dr. Firestarter. Do you have any last questions?
No.
You signed the consent form?
No.
No? Okay. I don't think you have for anesthesia. Let me double check your chart though. And it looks like you did sign the one with Dr. Firestarter to get your gallbladder out. And it looks like you also signed the anesthesia consent, but do you have any questions or do you want me to explain anything else before the anesthesia?
No.
No, everything's good. Okay. Well, I think that is everything we need to go through with you before our surgery. I'm going to go ahead and grab those medications, and when I come back, we'll get started, and then we can go back to the OR in about 10 minutes. Sounds good?
Okay.
Perfect.